Welcome to Fit and Bold, where we promote healthy lifestyles. I'm your host, Lakita Goins. Obesity. This is a word that we're hearing more often in recent years. I've seen several reality shows based on the topic, and today we're going to discuss what classifies a person as obese and the effects extra weight has on the body. We have Dr. Dewankasan here from the UAMS Area Health Education Center. How are you today, Doctor?
Good, thank you.
Okay, so let's start with, when is a person classified as obese versus being just overweight?
Overweight is a BMI of about between 24 to 29.
Okay.
And when you're above 29, you're considered obese in medical terms.
So, for our audience, what is BMI?
BMI is basically your base metabolic index. And this is a way of us measuring your height and your weight to see about proportionality.
Okay.
Okay.
So, what are the risks from being obese?
What's the risk of being obese? Well, you risk having hypertension, you risk having diabetes, you risk having sleep apnea, make it hard for you to breathe at night.
Okay, some people stop breathing, don't they?
And that's what sleep apnea is. And sometimes people will have low self-esteem because of it, and numerous other risks.
Okay, so I've seen the Let's Move initiative by the First Lady Obama, and she talks a lot about childhood obesity. How common is this issue in children?
Well, 10, 20, 30 years ago, it wasn't really common.
Okay.
Unfortunately, in our society today, it's becoming more common due to the fact that we have video games, fast food, and kids aren't going out and staying active as they used to.
Right. Are children who are obese predisposed to other medical conditions?
Yes, they'll grow up, again, have low self-esteem. They'll develop at an early age diabetes or hypertension.
Okay. So, what roles does genetics play in a child being obese?
Genetic plays some role in obesity. However, it's more of a lifestyle type issue. It's what you eat and the physical activity you have in your daily life that really contributes to obesity.
Okay, so sometimes like cultural experiences can contribute to you being obese. I'm just speaking from somebody where they like to throw ham hocks and pork chops and corn.
There you go.
I'm saying that's my family, so I know it can play a factor. So, are you, does it mean if you're a child and you're overweight, does that mean that you're more likely to be an adult and be overweight?
Depends. If your child's obese now or overweight now, it depends on what you're teaching them. Are you teaching them to eat healthier food? Are you teaching them to go out and play? You can modify, your weight. And some people will struggle with weight, and they're going to have more help than others with their weight. And there's a lot of different ways doctors can help people with weight. But the thing is, you have to be proactive in what you want. I mean, if you want to lose weight, it's something you have to really work hard toward. It's nothing easy.
Right. So if someone's saying, I want to change my weight, I want to make it better, what's the first step?
I really recommend the first step should be to go visit your doctor, because you need to be assessed health-wise. When you're obese, you might have high blood pressure, you might have diabetes, and if you go out and work out strenuously to lose weight, you can give yourself a heart attack or something where, it's better to be safe and go get professional advice before you start anything that's going to really drastically change your lifestyle or whatnot.
So, speaking on that, say you are obese or even a little overweight and you have had prior heart conditions or things like that, can your doctor still can you just not exercise at that point, or are there still ways to exercise?
Well, when people think of exercise, they think they have to go out and they have to go lift 200 pounds of weight. They have to go work out for 2 hours and run and whatnot. But you can work on a treadmill. You could use things with your arm. The biggest muscle group in your body is your legs, but the second biggest group is around your arms and shoulders. And there's a lot of different ways to lose weight. And again, it's a diet thing. It's a physical activity thing. You have to burn more energy than you're really taking in to lose weight. And if you still struggle after doing all these different lifestyle modification, doctors have other ways of going about to help you, between, let's say, surgery to gastric banding and whatnot.
So is it recommended to try those first, because some people will jump automatically to that, or is it better to try to lose weight without those?
Well, the best way is to live a healthy lifestyle and try conservative management, and which means, again, it's just eating really balanced meal, a healthier meal, and physical activity, because you can have things done and you can still gain weight because you never modified what caused you to gain weight.
Okay, that makes sense.
And not only that, it costs more, and then you're going through a procedure that's more invasive with a lot more risk.
So can you talk about, again, I know some people get discouraged if they're working out and maybe they're not losing as much weight as they see on those reality shows on TV. So can you just talk about encouraging words to the audience about losing weight and not having your expectations of what you see on TV?
Well, I've always consulted my patient about weight loss when they come see me. And what I tell my patient is you have to modify and change things that's sustainable. I don't tell them to go, hey, look, if you're eating fast food 7 days a week, I don't expect you to eat, broccoli and baked chicken 7 days a week. I expect, what I ask my patients to do is to do things that they can maintain. Stop eating maybe fast food for 3 out of the 7 days. Decrease your fat intake, gradually tapering. Same with exercise. If you go and try to exercise every day, 2 hours a day, eventually you're going to say, I can't take this.
You get
okay?
overwhelmed.
And that's why I tell them, look, go walking, fast pace, where you kind of struggle to talk because you're out of breath, have your heart rate elevated. And another way, and it just can't be just you, because it's a whole family thing. When you eat at home, you eat with your family. You don't eat by yourself, okay? So if you make it a family thing, spend time with your family, sit down at the table, something we've lost in our society, unfortunately. Discuss, their well-being, what they've done throughout the day. It's a great way to make your health, your physical health and emotional health, you're improving both. When you go walk, well, you're spending 45 minutes out of your day to walk. Why not take your husband, your son, a friend, and go spend time with them, help their health and your health, and it's now more enjoyable. Now you're not looking at it as a way of, it's an exercise. It's more just spending time with someone.
So what about the people that do have self-esteem issues? They don't want to walk around other people because they're worried about how they look. I mean, it's just a real thing. It happens, and people quit working out because they think people are watching them.
Now, how do we deal with that?
Yeah. What advice do you have for the audience?
That's a very tough issue, and I'm sure that's something that just didn't start, that day. It didn't start yesterday. It's something that I'm sure that over time we'll have to talk to our patient, counsel them, and help them through these tough times. If it's a depression thing now, there's things we can do, that help with the depression. There's places and there's programs to help people, that's overweight, work out together where they don't feel, conscious about, hey, look, I'm the only overweight person here, and there's all these fit people. There's ways around it, But the thing is, we have to look for the solution. We can't find excuses.
That's right. So, audience, if you are at home and you're saying, I'm ready to make a change, go to your doctor first and talk to them and get started now. And if you don't have a doctor, you may want to try UAMS, AHEC, right? So please stay tuned. When we return, we're going to be giving some healthy, fit and bold recipes to help you try to get back on track. Some of us have been there. I've been there. So stay tuned.
Your life is an open book. At the University of Arkansas at Pine Bluff, you can take advantage of scholarship opportunities and acclaimed academics with undergraduate and graduate programs tailored to achieve your plans. Learn from dedicated faculty and be challenged to reach your full potential. Get involved in campus life with student activities that add value to your character and give distinction to your collegiate experience. Become a part of the Golden Lion story at the University of Arkansas at Pine Bluff, where you'll be proud to be.
Welcome home, man.
Welcome back to Fit and Bold. Today we've been learning about obesity and how we can make a change as a whole. So first you want to consult with your doctor or physician before embarking upon any new recipe. But our Fit and Bold healthy recipe pick is fruit bowl salad with honey mint dressing. So if you're having weight issues and you've been battling it, or if you don't, it's good to get on a set meal plan to try to plan out your meals early in the day so you don't make poor decisions about fast food or things like that. So our ingredient list when you go to the store is 2 tablespoons of fresh mint, 2 tablespoons of lemon or lime juice, 2 tablespoons of orange juice, 2 tablespoons of honey. I used 1 cup of grapes, a half cup of pineapples, and 1 cup of pears. Now you can cater the fruit as to what you can find fresh inside the grocery store depending on what time of year you're trying to do a recipe like this. So first, I want to talk about why I use some of these things. The first ingredient I'm going to put in is the mint, and we need 2 tablespoons of that. So mint is good because it helps you detox. And a lot of people don't realize that, but it cleanses your body out. And not to mention, it also helps you keep fresh breath. And next I'm going to add the lemon juice. Now, lemon is very good for you. We're going to put in 2 tablespoons of lemon. Why is lemon so good? Well, it works on the accumulated fat in your body. So what this means is if you do a regular intake of lemon juice, and we're also going to put honey in this recipe, so the honey also helps if you mix it with the lemon juice. You can put lemon juice and honey into a cup of water, warm water, and drink it, and it's supposed to help you with the shape of your body. So we're just going to add 2 tablespoons of lemon juice. And I can already smell the mint and the lemon mixing together. Has a really good smell. Okay, after that, we're going to go ahead and add our honey because, like I said, honey and lemon mixed together, it works really well for you. Honey, it can be used for so many different things. I'm sure many of you have been to the store before and seen lip gloss that has honey in it and other beauty products. Honey also has some anti-inflammatory properties, and some people even use it to treat athlete's foot, believe it or not. And it's kind of thick, so you may need a second spoon to kind of scoop it out here. And you want to do 2 of these. Honey can also help with digestive issues such as ulcers or diarrhea. You would be surprised. I actually went and found the top 10 uses for honey. And it may be helpful to even warm your honey up a little bit because it can make it a little more pliable. And I'm just going to scoop this last part into here. Okay, and now you want to have your fruit. Now, fruits are always good, audience, because as we talked about before, fruits are colorful. Any colorful fruits or vegetables are always heart healthy and overall healthy. So what I have here are pineapples, and what I did was cut them into small pieces. You can mince them or dice them or do whatever makes you comfortable as far as the size. And I'm just going to dump them on into the mix. Then I have some large black grapes, and what I did with those is I just sliced them in half, and so you can see it'll help it coat better by having something for the mixture to stick to. So I'm just going to add these. And then lastly, I use pears. Again, it's a little chilly outside. It's getting harder to find some of those other fruits. But I just sliced the pears to a convenient size. And I'm just going to add those on into the mix. And you also get the added flavor of whatever juices come from the fruit. Now, all you want to do at this point is begin to mix it real good to make sure you get a good coating. And you can kind of see here. You want to get the mint and honey and lemon juice, especially that honey we put in there that's extremely thick. But you want to get a good mixture going till you can kind of see the mint on all of the fruit. And this will only take a few seconds, audience. The next thing you want to do at this point, and you have a couple of options. I had my fruit chilling, so I would be ready to go ahead and eat. If your fruit is not cold or you want to, you can always stick this mixture into the refrigerator for no more than 3 hours, and you can let it chill and kind of let the flavor of the lemon and the honey and the mint soak in a little. And then you can pull it out and it's ready to serve. Now notice this only took a few minutes to prepare, maybe add 10 minutes at most for prep time, and then it's a cold mix, so it's a quick snack or even a good breakfast. If you've been watching your weight, this is a good way to do it. And so I'm just going to go ahead and scoop a little bit out. And you can kind of see how it will look. And I'm just going to go for a piece and taste it to let you know what I got. Audience, this is so great. You can really taste the mint, but it's not too strong of a taste, so it doesn't just knock you out. But the lemon adds a special kick, and also I can taste the extra sweetness of the honey. And I also, if you notice, did not use the orange juice, but you can throw the orange juice in to add a little extra flavor and also add more vitamin C to this dish. So remember, anybody can eat healthy. You don't have to sacrifice taste to do so, and it can help you control your weight as well. When we return, we're going to be doing our workout with some SWAC champions, so stay tuned.
Four years ago, I went through something that was very difficult for me. I was faced with a very big challenge at a young age. I didn't want to tell my parents. I really didn't want to tell anybody, and I didn't. I shut down. Once I reached out to my sister, it got a little better. Once I told my mother, it got a little better. The more I talked about it, I felt it coming off. If you're strong enough to just open your mouth, that's all it takes.
Hi, I'm Terry Williams. Can I tell you that it is way past time for us to come face to face with the issue of mental illness in the Black community? Time for us to stop hiding it behind closed doors. Share ourselves. Healing starts with us.
In the event of a car crash, 3 out of 4 kids are not as secure as they should be because their car seats are not used correctly. But the latch system makes it easier to get it right and to hold your kids tight. Anchor, tether, latch. Learn more at safercar.gov.
Welcome back to Fit and Bold. Today we've been talking about obesity. We want to show you that working out is important, so I'm standing here with the 2012 SWAC champions. Hi, how are you guys today?
Good.
Okay, introduce yourself and tell us your name and your classification, your major.
My name is Kimmis Robinson. I'm a freshman and I'm majoring in kinesiology.
Okay.
Cody Swain, I'm a freshman and I'm majoring in history.
How does it feel to be a SWAC champion?
It feels awesome. It feels great.
All right, how do you feel?
It's the best feeling in the world.
All right, so what are you going to have us do today?
Today, we're going to start out with some jumping jacks.
Okay.
And then get into some lunges and do some hip rolling.
Okay.
Get you loose. And some bend and reaches is what we call it.
All right, it sounds good. So audience, get your workout gear. Let's get ready to exercise. All right, Cody, so show us what we're going to be doing first.
All right, today we're going to warm up with some jumping jacks. Everybody knows the common jumping jack.
All right, how many?
We're going to start off with 10.
All right, I'm ready.
All right, let's go.
2, 3, 4, 5, 6, 7, 8, 9, 10.
Hey, so what's next?
All right, we're going to start with some lunges. We're going to do 8, 6, and 4. We're going to gradually go down.
Okay. All right, can you give us an example of a lunge for the people at home that don't know?
You're going to take a step forward and lunge all the way down.
Okay.
Come up. That's 1. You're going to do 4 on both legs.
Okay. All right, we're ready.
Again, we're going to
All right, I feel that one. So what are we doing next?
we still have 2 more sets to go on lunges. We got 6 and then 4 to finish it up.
All right, well, I'm ready.
All right, let's go. 1, 2,
4?
Yep, we got a last set of 4.
All right, tough it out, audience. Okay, so do we have anything else today?
We got 2 more exercises left.
Okay, well, let's do this next one, and I'm ready.
All right, we're gonna do what we call rolling. Loosen your hips up, and you're just gonna roll like this all the way around.
Okay.
Rotate.
All right, sounds
We
good.
got 2 sets of 10 seconds.
Okay, I'm gonna let you keep counting.
All right, all right. And we're gonna reverse it to the other side. Everything you do, you must do twice.
Okay, I've already heard all my bones popping, so I'm ready.
All right.
All right, well, thanks for that wonderful workout. That was a wonderful workout. We've been talking about top 10 reasons not to exercise. And one of the reasons, especially if you feel that you're overweight or you are overweight, it could be that you're worried about how you look exercising. Well, I can tell you this, don't worry about what you look like. The point is that you're working hard and you're trying to get to a goal that you want to be at. So remember, we worked out today with Swag Champions, and you can be a champion too. You can be your own champion. All you have to do is get into your healthy lifestyle journey, get fit, and be bold.